brands and the bling and the expensive thing, oh, I never had the money, never had nice living. And mama say, oh, you could have it all, just work hard for yours. I say, mama, you know I'll work hard for sure. Now Jaja bless me with the opportunity to fly country to country. Now I could drink champagne when I thirsty. Now I could see only thing I never see. They say this hour youth man so lucky. But I thank me for the run the family. Now no bad mind boy they can stop me. On every show I smiling cause trust me, life is so lovely. Whoa. And I'm far from finished. Whoa. And I can't believe it. No. See I'm far from finished. Whoa. Love the life that I live in. Yeah. I say na na na. I say na na na. Say na na na. I 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 say na na na. Forever thankful for doubters in the past and the people who laugh on her. Forever grateful for all the times I failed. And Papa say, oh son, you can't give up. What's for you is for you. I said, Papa, you know I will never stop, no. Now Jaja bless me with the opportunity to fly country to country. Now I could drink champagne when I thirsty. Now I could see all the thing I never see. They say this hour youth man so lucky. But I thank me for the run the family. Now no bad mind boy they can stop me. And every show I smiling cause trust me, love is so lovely, boy. And I'm far from finished.
Just work hard for yours. I say, Mama, you know I'll work hard for sure. Now Jaja bless me with the opportunity to fly country to country. Now I could drink champagne when I thirsty. Now I could see only thing I never see. They say this hour youth man so lucky. But I thank me for the run the family. Now no bad mind boy they can stop me. On every show I smiling cause trust me, life is so lovely. Whoa. And I'm far from finished. Whoa. And I can't believe it. No. See I'm far from finished. Whoa. Love the life that I live in. Yeah. I say na na na. I say na na na. Say na na na. I say na na na. I say na na na. I say na na na.
Forever thankful for doubters in the past and the people who laugh on her. Forever grateful. Yeah, yeah, yeah. I feeling it, I feeling it, I feeling it, I feeling it, I feeling it. Right now there's vibes here on overload, and I can't wait to touch the road. This party here puts you in the mood, the kind of mood to wine with attitude, jumping with hysteria, hysteria. Get on by, yeah. Come let me wind up all day. Hold me, fanting away. Hysterians in the party, and everybody here will acting wild and bullshit. Come let me wind up, come let me wind up, come let me wind up all day. Oh, let me fretting, oh, let me fretting, oh, let me fretting away.
So team 2 now, let's go again. So let's hear your left and right.
My right neighbor is Dimples Kiran Ramlogan Stout. And my left neighbor is Aisha Lynette Jamalil.
Excellent. So we saw some improvement here, right? So this is the last one, right? So we go into team 1 again. So this will be your last circle.
All right. To my right, I have Radhika Aisha Khan. And to my left, I have Marion Victoria Bassi.
Okay, so excellent. So you all stay first. I need to get a bow from you all after. Good. So team 2, last spin, right? Oh, you chose. She didn't choose you already? No. Oh.
On my left, we have Miss Heather Duncan, and on my right, in this lovely dress, we have Miss Eileen Madonna Charles Peters.
All right, thank you everyone. So before you all go, please give them a round of applause. Maybe next year we should do like a modeling segment.
Excuse me. You wanna like a shoe?
This one? All right, so I hope you all had fun. Okay, good. So let's get on. But before we start, right, there's this quote that I really love, resilience. You all know the meaning of resilient? Yeah? So let me go with it. Resilience is accepting your new reality, even if it's less good than the one you had before. You can fight it. You can do nothing but scream about what you've lost, or you can accept that and try to put together something that's good. That's a quote by Elizabeth Edwards. Now, I'm a type 2 diabetes person. I've been living with it for about approximately 20 years. And since then, I've been resilient. I've been up, down. Up to last year, my challenge was really difficult. And I've learned a number of things, but resilience is one of the words that remains in me. And this is something that we have to try to overcome our difficulties. And you know the saying, when you get lemon, what do? You make lemonade, right? So we don't do the negatives, we always look for the positives in everything. Good? Now, I want to introduce Dr. Sabrina Ramkisoon, and she's going to talk about polycystic ovarian syndrome and diabetes. But before we start, let me just give you all a little information on Dr. Ramkisoon. She's a specialist obstetrician and gynecologist. She attained her Bachelor of Medicine, Bachelor of Surgery at the University of West Indies, followed by her specialist membership at the Royal College of Obstetricians and Gynecologists in the UK. She also went on to do a fellowship in minimal access surgery in Dubai. She pursued her degree in this specialty from absolute passion in women's health. Every day she focuses on encouraging and empowering women. She often partakes in awareness drives like this one today to help women gain a better appreciation and understanding about their health and bodies. She continues to be part of the global fraternity and constantly partakes in continuous learning. She quoted, medicine is continually evolving and we must keep updated so that we can offer the best care as we can be to our patients. Her motto is, think it, believe it, achieve it. So let's welcome Dr. Ramkisoon.
Hi, good afternoon, everyone. I see you all just came off of an exercise, so everybody should be high on energy and on focus and concentration. My mission today is simple. I was given a few points to discuss with you, and mainly about just insights into polycystic ovarian syndrome. I'm not sure, by raise of hands in the audience, is who's aware of this polycystic ovarian syndrome, also known as PCOS. Raise of hands, you've heard about it, you have somebody that is struggling with it, you have a daughter, you yourself, so quite a lot of hands are up, and therefore my work is done and I probably could leave, but no. I want to go through the list that was given to me just to be able to give you insight into a couple of points that are important. So I had 4 points to go through. The first is to explain the link between PCOS and the risk of developing type 2 diabetes. I was asked to clearly outline signs and symptoms and also the impact on fertility and your reproductive health. I was also asked to share tips and strategies for managing both PCOS and diabetes. And finally, to list and emphasize the importance of regular checkups and screening for young and older women. Sounds long, but it's not that bad. So let's dig into it. The first thing, explaining the link between PCOS and the risk of developing type 2 diabetes. Now, the first thing to be aware of before we go into that is that PCOS is one of the most common hormonal diseases, and it actually affects between 6 to 12% of women, mainly in the reproductive ages, and this is an international incidence. But it's a lot more than just that. This lifelong health condition continues far beyond our childbearing years, and for some, it may even onset early. So girls that are actually in their teenage years, for all of you moms that are listening, this is something that I want you to get familiar with your daughters and their menstrual history, helping them to understand that there are some red flags that we want to look for along the way. And you as a mom, because I see a lot more moms in the audience, you want to be that person that can help your daughter detect, or you yourself, if your period history is irregular, you want to be able to detect this at an early time. Women with PCOS are often insulin resistant. And what this means is, I'm sure all of you are familiar with insulin. You've gone through attending a whole conference today at the Diabetes Association. So you must have heard this word insulin and insulin resistance at some point. What insulin resistance means is that your body is producing insulin, but your body's cells are not able to read the insulin. So in not being able to read its insulin, the function of the insulin is now challenged. And this is what we term insulin resistance, which is actually also something that happens to type 2 diabetics. So there seems to be some sort of link between insulin resistance in polycystic ovarian syndrome girls and the insulin resistance of our type 2 diabetics. Our type 1 diabetics are not insulin, well, they're insulin dependent, So they don't have a resistance, but they actually are not producing sufficient insulin. So that's where the difference lies. Insulin is a hormone, and it's produced by it's produced by an organ in our body known as our pancreas. And basically, the function of insulin is to allow our cells to use sugars that is our body's primary energy supply. Now, if the cells become resistant to this action, then guess what happens? Our blood sugar levels are going to rise. This is something known as hyperglycemia, and it's a weird medical term that stands for a raise or an elevation in the blood glucose levels of our body. Again, something you must have heard along your day attending this conference. Now, insulinemia, which is known as a high insulin, and hyperglycemia, they go hand in hand. So we fall into this vicious cycle where the glucose rises in our body, and to compensate, the insulin also rises because the insulin is trying to get the glucose down. But what the insulin is not understanding is the body is not working with it. So there's a disconnect. And this is where hyperglycemia or high glucose is going to cause hyperinsulinemia, where the insulin is also going to raise in our body. Now, too much insulin in the body can cause problems. And insulin, along with other female hormones of our body, mainly our estrogen, our progesterone, and our testosterone, because yes, ladies, we actually do have a little bit of testosterone, and this is known as our androgen. So the word androgen means testosterone or male hormone, but women actually have a little bit of testosterone. The problem is hyperinsulinemia or high insulin in our polycystic girls is going to raise their testosterone levels. So women are now walking around with more testosterone or male hormone than is actually needed. And this causes a whole bunch of things which we'll look at shortly. So just to look at this little diagram, it basically ties in this high insulin. And what it also does, it affects our lipolysis. And lipolysis has to do with our fat breakdown. So in understanding how the insulin causes weight problems, because the main thing that happens with PCOS girls is that they get this central obesity. So if you notice, the rest of their body looks okay, but it's the central area, which I think a lot of Trinidadians have anyway because of bad diets, but you know, the condition is such that it does impact our central obesity or our abdominal fat. And this fat, increasing this fat actually puts us more at risk of things like high cholesterol, puts us at risk of things like stroke and heart attack. So we really must put a lot of emphasis on reducing this central obesity, but we have to also understand it's very, very challenging. You don't just lose inches off of your waist. I'm talking to a full panel of women with a couple guys inside. So you'll find men are going to lose the weight fast, women are going to just be resistant. We're going to the gym, we're eating well, we're tightening up on diets. And unfortunately, if your PCOS is affecting your insulin, you're going to struggle with this central obesity. So don't give up, understand what's happening, and we're going to keep going forward. So just to go through a little bit more about this, it shows again the obesity which we discussed. Now it also affects our energy and our metabolism. So you're going to find that you're going to feel hungry all the time, and therefore it's going to increase your eating, and then it's going to go on and on. We have a dietitian in the house, so she's going to explain more detail or touch on things in terms of diet and how to manage, and there's so much there. But that's just a little bit about what happens in this whole cycle. And of course, if we know that our metabolism is dropping and our central weight is increasing, we're going to feel fatigued. We're not going to have energy. So as doctors, we sit on one end and we tell you, well, you have to exercise. You should be in the gym. You need to be exercising 3 to 4 times a week for 30 to 40 minutes at a time. But if you are fatigued and you get up in the morning and you don't have the desire, how are you going to really combat and deal with this syndrome? It is very challenging. Importantly, hyperinsulinemia causes androgens. I think I went through that. And we just summarize this first point before we head into the second. So, women with PCOS can develop serious health problems, especially if you are overweight. More than half of women with PCOS develop type 2 diabetes by the age of 40. And gestational diabetes, or this is diabetes when you're pregnant, can put the pregnancy and baby at risk and can lead to type 2 diabetes later in life for both mom and child. So this is something that's very important to tighten up before you head into your fertility trying phase, because you don't want to now get diabetes in pregnancy or get diabetes after you've delivered. Anybody needs a break or I can continue? Yes? So we go straight into the second point, outlining the signs, symptoms, and its impact on fertility and reproductive health. Some of the signs that you want to look out for are simple things. And a lot of other women who are not polycystic also struggle with these signs, so it makes it a little challenging to understand who has it and who doesn't. But the things you want to look out for is acne, and you want to particularly look out for the cystic acne, oily skin. You know, sometimes you might have little heats and we call it acne, but really and truly the polycystic acne is more of a cystic, it's more of a pus-filled, it's more along the edges of the chin line and these areas. Back is also possible, so some girls complain of back acne, or they might get acne behind the arms. So those are the types of acne that you're looking out for. Velvety darkening around the neck, and it's known as acanthosis nigricans. I'm sure at some point you've seen somebody's neck and she's struggling with polycystic, and you may not do it, but some people then wonder, is that person taking a bath? Is that person scrubbing her neck? I mean, it looks like there's, they call it muck. That's what's going on there? She's probably not showering as much, And then you might want to tell her about exfoliation and all of that. But what is actually happening is the skin is changing in its thickness and it's also changing in its color. And this, unfortunately, it drops women's confidence. They're seeing this darkening on the neck and people are commenting about it. And there's nothing you can do to really get rid of it. You have to manage the underlying insulin, which is not a today for tomorrow thing. So you're going to be living with this darkening on the neck, and it can create a lot of issues for your confidence. Excess body hair, including areas like your chest, your stomach, and back. Now, I know we also walk around and we see women have chin hairs. So patients commonly come in the office and I say, well, have you noticed any hair on your face? Well, doc, I have one chin hair right here. I said, no, that is actually not what we call hirsutism, because a lot of us can have 1 or 2 strands of hairs in different areas. But what we're looking for is this male type, and male type hair, as you would realize, is coarse. So it's not fine and thin like a woman's hair. It's more of a coarse hair that looks more like a, mustache or beard or that type of thing. So we're looking for it along the lower edges here, and it's usually a lot thicker than just a 1 or 2 strand. Male pattern baldness or thinning of the hair is also something, and you'd find that women often see a receding of the hairline, or they might notice a lot of thinning on the surface, on the top of the hair. So this is also in keeping with this syndrome. And finally, a sign that we look out for as gynecologists would be ovarian cysts. Now again, some people come in the office and they say, well, the doctor saw an ovarian cyst, but there's a difference. An ovarian cyst is actually a large fluid-filled structure in your ovary, and a lot of women along their menstrual time may have had one of these. But the cysts of polycystic are different. They're actually follicles, and follicles are these things in our ovaries that are very small and they're filled with a little fluid, but they carry our eggs. So as women doing an ultrasound, don't get scared when your doctor says, well, I see follicles, because that is something that is in keeping with a woman's body, especially reproductive years. But sometimes the word is interchanged, and then the doctor is going to say, well, I see plenty of cysts in your ovaries. So when you hear that the doctor is seeing lots of cysts, what they really mean is we're seeing a lot of these little follicles. They're about 10 millimeters or so in size, and they fall into the ovary like what we call a string of pearls. So I'll show you a photo in a short while. So this is what we see on the pelvic ultrasound as a sign of polycystic ovarian syndrome, and it's known as your polycystic ovary, right? So just to give you a little picture of the things we talked about. So you notice the cystic acne, right? And it's all under the chin area. The acanthosis nigricans, the darkening on the side of the neck. So you see it looks velvety, it's coarse, and it is discolored all the way down the side of the neck. And then, tell me what the third one is, somebody. What's the third picture? Hirsutism. So that's a medical term, but it basically means male pattern hair. So you notice how thick it is, you notice it's coarse, you notice it's taking up the entire chin area. On the photo on the left, we see the thinning of the hair, and we see the male pattern. Men have a different hairline to women, so you start seeing that change in the hairline. And then finally, as I discussed, the string of pearls. So that's the ovary having a lot of those little follicles around, especially around the periphery or the outside of the ovary. So that is our signs that we're going to look out for. Symptoms. They are brief, but mainly polycystic ovarian syndrome girls can have irregularity of their menstrual periods. So they might have missed periods, meaning they might skip a month or they might skip 2 months, but you can also actually skip up to 6 months, and some women actually skip a full year. And this is what we term amenorrhea. So amenorrhea is a word you'll hear if you're missing periods for a couple of months. But your periods, in addition to skipping, that's the pattern of the change, you could also have a change in the flow. So you'll find that the flow might get lighter, and you notice that your period is going from 7 full days to 5 full days to 3 full days, and then it's barely coming. So the lightness of the flow is another important thing that happens. Having few menstrual periods can be challenging for your health later on, because in fewer periods, the tissue that lines your womb may not be shedding effectively, and it might be building, and this actually puts women at risk of cancer of their womb later in their later years. So this is something serious. If you have an irregularity, don't take it for granted. Don't not seek medical care, and you really want to get more regularity of that flow, because you want that lining to be shedding, because nobody wants cancer of their womb later in their years, just from polycystic ovarian syndrome. Another symptom, we talked about it, the central weight, so we can bypass that one. And this is something that I think needs more focus. Women with PCOS have anxiety. They are depressed. And this is something that we must put a lot of emphasis on, because you wake up and you are depressed. Clinically, you are depressed. And then the doctors or somebody says, no, that can't be related to your PCOS. Your PCOS is something that affects your ovaries. No, ladies, PCOS affects women's moods, your energy levels, your depression, it affects your anxiety. So in a couple of slides down, I'm going to talk to you about, it's a team approach, it's a holistic approach. It's not just a gynecologist managing PCOS. This has to be that multiple people get involved to help you with all of these different aspects. And sleep apnea is actually something as well. So that's where you kind of stop the breath while you're sleeping, and then you start back breathing. That's also something serious, associated more with women who are obese and have the PCOS. So that's something you need to look at as well. Now let's talk a bit about the impact on fertility. And the main thing I want to give to you about fertility and PCOS is that it affects your ovulation. It affects the release of your egg. And if we are not releasing eggs, then we're not going to achieve our pregnancy. So in understanding the why we don't ovulate, I think we can understand based on the slides before, where we looked at the pattern of the follicles along the ovary. If all of these follicles create a gate and they create a wall, then there's no space for one of these to grow. And therefore, if a follicle is not growing, it's not going to release its egg. So in understanding that we need to ovulate to get pregnant with polycystic, and this is not all girls, these are just the girls whose ovaries are very affected with the follicles, we want to understand clearing them up, and we want to understand the role of fertility treatment in helping us to ovulate. Because a lot of the time, PCOS girls, somebody told them they can't get pregnant, they are infertile, and this is not true. We can help you ovulate, and we can help you to achieve your pregnancy. So don't listen to everybody. Listen to the main specialists that are rooted in your corner. With PCOS, the ovaries might also produce a lot of androgens. We went through this already. And androgens or testosterone also is going to impact your ovulation, because the female hormones are responsible for ovulation. The male hormones are going to be against ovulation, and there's going to be a vicious battle between things in your body and you releasing your eggs. So that is something that we will focus on when you come in the office, and it's a real detailed conversation. In the interest of time and keeping your attention, we're not going to go too deep into that. Now, health problems. So this is something just to understand. Women with PCOS can be at a higher risk of heart disease. The risk does increase with age. So if you are in your later 30s and you're struggling with PCOS, please also go to your GP. Please also have a general check. Please also let them do any testing that they see necessary to see what your risk is for heart disease, because the risk is increased. And high blood pressure is also something that we see with PCOS, and it has to do a lot with the changes in the hormones and the disconnect between the hormones, the kidney function, everything is disconnected. So high blood pressure is something you want to control, because we don't want you to get issues of damage to your heart, your brain, your kidneys. All of that can be affected by hypertension. Cholesterol is another big thing, and I'm sure you didn't realize that PCOS can cause all of these changes in our body, or some of you may be aware. But your bad cholesterols increase, your good cholesterols decrease, and this generally also puts you at risk of heart disease. So if you are able to control this syndrome from an early age, you're not going to get to the point where this is happening. Sleep apnea, so we also talked about that, and it's included in the mix of putting you at risk of heart disease and type 2 diabetes. And of course, stroke is also part of this, because we can get blood clots as well. So third one, we're almost to the end. Sharing tips and strategies for managing both PCOS and diabetes. Now, again, I mentioned earlier, PCOS treatment is focusing on things that are concerning the person at the time. One girl is going to present with regular periods, but she has PCOS syndrome and her ovaries might be affected. Another girl is going to present with missing periods for 6 months to a year. So if you understand, not everybody needs to be managed the same, or not everybody can be managed the same way by a health professional. We have to sit with you, discuss your history, discuss the things that are affecting you, and then we get a targeted management plan depending on what is affecting you at the time, because everybody presents at a different time and with a different situation. The main thing, however, is to make sure that your periods are regular, to make sure that the rest of your general health is being checked properly, and to make sure that things like the fertility aspect, if that's affecting you, your effect of the hirsutism, how is the acne impacting you? Do we need to talk about weight loss strategies? Do we need to refer you to a dietitian or to a trainer who can better help you? So these are the specifics that we look at. But basically, lifestyle changes is known by all of us. We must get our calorie diet to fit our BMI ratios and our exercise activity. And this is something that is known. Even if you lose 5% of your body weight, this actually improves the polycystic. We see women going from missing periods to every month they're getting a regular period, simply because they focus their energy on reducing a 5% weight loss, right? And so the impact of lifestyle is important. I know some people come into the office and say, really, the doctor said just change my lifestyle. But yes, we know on our end that 5% or more of losing your body weight is going to make a difference to your general health. Again, going over dietitians and weight loss plans, very important. Now, in terms of our medications, so you'll find that you go to the gynecologist and they say, okay, well, you should go on a birth control pill. There's a reason for the birth control pill, and it's mainly for the women who are not regular. Now, if you are regular with your periods and you're not looking for birth control, we're not just going to tell you to go on a birth control pill. So it has to be specific to what is going on with your menstrual history. But our focus of putting you on the combined birth control pills or on progesterone, which is another type of hormone pill, is mainly to allow that lining to shed. Remember, we spoke about earlier, if we don't shed the lining effectively, we could build up and get cancer late in our years. So our medications and hormones are targeting lowering your risk of endometrial cancer. It's not just putting you on another birth control pill, and we have to understand why that happens, because people get frustrated, they say, well, can't you do anything else? But understand the importance of why we do what we do. So that's talking about progesterone. And just a little bit about ovulation. There are, as I mentioned before, ovulation medications that can help you to release your egg. So if you are struggling, you think you're not ovulating, get to the gynecologist or fertility specialist, and they will talk with you about stimulating your ovaries and trying to get you releasing your eggs. So you'll just see me mention clomiphene, letrozole, also known as Femora. These are our common fertility stimulants that we use. And then there's metformin. A lot of people do not like metformin. Metformin can cause a lot of side effects. So metformin is also similar glucophage. You will hear these things, and a lot of you out there who may be diabetics may also just be on these medications. But the side effect profile can be high for some. And what happens is you get diarrhea, your quality of life is affected, your quality of your work life is affected. You may not be able to go to work because you're trying to take this tablet that is designed to help your insulin to sensitize itself. But there is a big role of metformin in helping with polycystic ovarian syndrome and insulin resistance. So along the way, we may want to recommend this to help with your insulin, because earlier we talked about how much insulin impacts everything in our body. So this is a team, and this team should be, based on what's happening with you, but generally, a gynecologist alone doesn't manage PCOS, and I think that this has to be a team approach. You have to have your GP, you have to have something known, your endocrinologist, who is your specialist dealing with the diabetic aspect, your gynecologist, a dietitian, a dermatologist, because we have to help you with your acne, and we also have to help you with your hirsutism, a trainer, if it is that you can't exercise on your own, which a lot of us still do at home, fertility specialist, if that's the area that you're at, and psychologist to help us with the mental aspect. Now, my final points, and then that's it. Listing and emphasizing the importance of regular checkups and screening for younger and older women. So women, particularly in their reproductive years, should do regular screening, and this is what we know as your wellness check or your well woman check. And this should be done at least every 6 months for some, but ideally every year or on an annual basis. You should go to your gynecologist like you go to your GP. So it's a general health and wellness. It looks at your mental health. We look at your metabolic health. We look at your reproductive health, and we look at your endocrine health or your hormone health. And the important thing is, if you remember nothing else I've said today, early detection can improve outcomes of everything. So it's important to pick it up early. Just to list a couple blood tests that your doctor may advise you to do. I mean, we all know HbA1c. We've probably heard it all day today at the symposium. So HbA1c is a non-fasted test. It's done at a random point, and it gives us an idea of your control for a couple months before the test is actually done. And of course, for some, the glucose tolerance test is a diagnostic test, so your doctor may advise one or the other. Things like your female hormones, and this is more for the girls who are in their fertility windows. So FSH, LH, estrogen, these are hormones that are produced to help you to ovulate. Thyroid functions, because some women with thyroid disease actually also might be mistaken for having polycystic. So it's important to do what we call a differential, or to do certain hormones to rule out other things that are causing similar things to polycystic syndrome. And of course, testosterone. Now, a lot of women actually have normal testosterone levels in PCOS, but there's some that are going to have raised levels, and they may need additional treatment to reduce those levels. Otherwise, they get very severe symptoms and signs. And finally, your cholesterol, because we spoke about cholesterol and the role of it in PCOS. So, early screening, detection, timely intervention. We're not going to waste on your glycemic control. Everybody should get on board. And finally, PCOS is a chronic condition that currently cannot be cured. And the medicine is constantly evolving, so one day we're going to wake up and we're going to hear that there's a tablet to cure you. But until that point, we got to manage your symptoms. We have to manage, especially through lifestyle changes, certain medications, and for those who are trying fertility treatments. Type 2 diabetes is a big risk, so doing your annual screening, your HbA1c, your glucose tolerance test is very, very important. That's it. Thank you.
Thank you. All right, thank you so very much. So I would call Anicia to do a presentation to Dr. Ramki soon, a little appreciation token. You want to come on this side?
Thank you, thank you. Yes, I'm going to take it, yes.
All right, so I have an announcement. For those who didn't get any lunch for lunchtime, the lunch is here. So if you all want to leave and go pick up your lunch, eat, and get yourself more comfortable, you all could go. But we have Miss Maraj, who's going to talk just now. And her topic is eating for diabetes, nutrition for blood sugar control. So if you all want to come back and listen, just let us know so we can just hold on for 5 minutes. Anybody going for the lunch though? So 1, 2, 3. Okay, so yeah, they'll collect and come back. So we will just wait 1, 2 minutes and we will continue. Or 5 minutes? Yeah? Okay, so 5 minutes time, right? So just continue the game we were playing earlier on to get to know your neighbor, your left neighbor and your right neighbor. Except those who sitting together, maybe you all should just walk around and stretch your legs and know your neighbor in the back or the right. Niala? Hi, so we came up with our next idea while you're all waiting. So we're doing some questions. So those of you who would have questions for Dr. Ramki soon, you all are welcome to ask the questions, and we will have the mic passing along. So those who want to talk, please walk to the side where the railing is, and we will walk with the mic for you all.
I feel you all shouldn't have questions without lecturing, you know. As in live in South or have an office in South? Well, I was born in Victoria Nursing Home, so yes, I'm a Southie by origin. No, she's not. Yeah, I get asked that all the time. But I heard she was a lovely lady and quite a very nice gynecologist.
Hi, good afternoon.
Hi.
Based on all the side effects that metformin gives, is there any other alternatives that somebody can use?
Of course. So I guess I try not to put it in a medical lecture simply because, as doctors, if we have nothing medical in terms of evidence-based, then, recommending it to patients is more about our preference and what we see in terms of patient testimonials. But I'm sure on TikTok and a lot of these places, you'll are seeing inositol. So inositol is something that we are seeing promise in terms of its effect on insulin resistance, and inositol is produced by our bodies, but what we're thinking is that there's an underproduction of the inositol in polycystic ovarian syndrome women, and so this tablet, or it comes in a powder form or whatnot, we're seeing that it is helping the symptoms. We're seeing regularizing of periods, but to say that I think it's happening on its own, I don't think so. I think it has to be a general approach to your health and wellness, looking at your BMI ratio. You want to get to a target BMI, but at the end of the day, we're not going to ask a woman whose BMI is 40 to drop to a BMI of 20, right? That's not realistic. So in understanding BMIs and lifestyle changes and inositol and diet and, monitoring, putting all these things together, we have seen a lot of positive things come out of that. So yes, inositol is something that's been around and it's been showing to help PCOS girls with fertility, weight control, and also cycle regularity. Yeah, pregnancy is a tricky area, and the reason is, again, we don't have a lot of studies that show us safety, but if we understand that inositol is a regular product, and it's a natural product, then it should not have any impact on pregnancy. But I don't have a category in pregnancy to give you full confidence about use. I don't think it's shy. I think they learned everything they needed to know.
Maria.
Hi.
Hi.
The birth control pill. I know it works because shortly after a relative came off the birth control pill, I have a beautiful niece now.
Of course. And I think that it has to do with how fast a birth control pill clears up those extra follicles in our ovaries. So time and time again, when we put women on a birth control for a month or 2 months or even sometimes 3 months, when we look at the ovaries after that time, we actually see extremely clear ovaries. And I think some women, they don't want to go backwards a step to go forward, but I try to help women understand that to clear up those ovaries very quickly, sometimes we need to invest in a birth control for a short period of time, because I think that there's a huge role in fertility in clearing the ovaries first and then heading into, you ovulating naturally. So I do believe there is a big thing there where we see a lot of times they get pregnant right after they come off that pill. That month after is a golden month, so. So yes, that is something that we see. Great. It's my 6th-year anniversary. I must get to my husband, so thank you very much for your attention and your limited questions. But no, if you have any further questions, I'm always happy to receive them, and I could always redirect. Yes. Thanks a lot, guys. Bye.
All right, so let's give her a round of applause. Good. So our next speaker is Miss Mazaj Mohammed. Mazaj is our very own nutrition assistant with the Diabetes Association. So Ms. Mazaj Mohammed is a registered dietitian, passionate about diabetes prevention and management. She is a past recipient of an open scholarship from the government. She holds a BS honors in human nutrition and dietetics and a diploma in institutional and community dietetics and nutrition with distinction, and has co-authored research on food security. Ms. Mohammed is currently the nutrition assistant at the Diabetes Association of Trinidad and Tobago and conducts nutrition consultations with persons living with diabetes. So Ms. Mazaj will be talking about eating for diabetes, nutrition for blood sugar control.
Okay, so good afternoon, everyone. Are you all hearing me? Okay, so thank you, Shobha, for the warm introduction. So I will now start the presentation, just to make sure. All right. So today I will be presenting on eating with diabetes, nutrition for blood sugar control. So through this presentation, I hope to address and resolve some misconceptions when it comes to diet and diabetes, because there are lots of things that people do, there are lots of things that people hear, and hopefully through this presentation you will be able to understand really what is happening in the body and what needs to be done diet-wise. So then you will be able to filter out the science from the nonsense, right? So these are, well, I put the bubbles here to show some things that people do when they find out they have diabetes, or if they're just frustrated and they want to try something. So they cut out certain things from the diet. They cut out flour for some reason as the first thing to go, not sure why. They also cut out rice, potato, fruits, etc. So this is an outline of my presentation. So before we understand diet, we need to understand what happens to food in our body. So after we chew and swallow food, what happens? Then I'll talk about what a diabetes-friendly diet consists of. Then we'll actually talk about creating balanced meals using a plate guide. And then lastly, I'll cover some healthy eating tips for persons with diabetes. And just as a disclaimer, I know you would have heard about chronic kidney disease and so on earlier today. Just a disclaimer that the nutrition education that I provide in this lecture does not apply to persons with chronic kidney disease, only because chronic kidney disease requires different dietary changes from diabetes. So this really is for persons with diabetes, or whether it be as well as high blood pressure or cholesterol. So the first thing to kick off is what happens to food in our bodies after we eat. So food is digested in the body after we eat. So digestion is how our body breaks down food to get the nutrients. Our body cannot use the chewed and swallowed foods as it is because it is still very big. So our body has to digest it in order to get the nutrients that are found in the food. And the diagram there is basically showing some of the organs involved in digestion of food in the body. So there's the mouth, there's the throat, there's the liver, the stomach, the intestines, and the star we show the pancreas is also there, right? And Dr. Sabrina would have mentioned what the pancreas does. The pancreas actually makes the insulin, which is the hormone that allows the sugar to enter the cell. So now we'll focus on the digestion of carbohydrate, because carbohydrate is the next stop we show when it comes to diabetes. So carbohydrate from food is broken down into glucose, or what we call sugar in the body. And the cells need glucose or sugar for energy. Now the main dietary factor that affects blood sugar levels is the amount and the type of carbohydrates in the diet. And now I'll refer to the chart here, the flow chart that is in the green. So it shows what normally happens every time we eat or drink something. So ideally, what happens is the carbohydrates in the food is digested, so it's broken down into glucose or sugar. The glucose then enters the blood, and as expected, the level of the sugar in the blood will increase, and this is normal. This is what we would expect to happen after we eat or drink something. When the level of the sugar in the blood increases, that actually signals the pancreas to release the insulin, right? And insulin acts as a key to open the cells so that the sugar goes from the blood into the cells so that the cells can use it for energy. And when that happens, the amount of sugar after we eat in the blood starts to drop and it returns to normal. And so it's a cycle. So every time we eat or drink something, this is what happens in the body to bring the sugar back down to where it was before. Now, in terms of the diabetes, as Dr. Sabrina would have mentioned, well, she did it in relation to PCOS, but remember she said the insulin resistance is common to both PCOS and diabetes. So what happens is the body is making the insulin, in the case of type 2 diabetes that is, but the body isn't using the insulin well. So in terms of the diabetes now, when it comes to the carbohydrates in the diet, how fast the carbohydrates raise our blood sugar depends on what the food is and what we eat the food with. So what a diabetes-friendly diet consists of. So going from the diagram, you will see 5 different main points as to the main components of a diabetes-friendly diet. So this is a diet that ideally will help to counteract that insulin resistance that Dr. Sabrina would have talked about. So the diet should be high in fiber. So fiber is actually a type of carbohydrate that is not digested, right? And that's where it stays in the bowels and it regulates our bowel movements and so on. So fiber is a type of carbohydrate that is not digested and it actually helps to slow down the digestion of any other food that we eat. The diet also should have enough protein and enough heart-healthy fats. So enough meaning we don't want too little in the diet and we don't want too much. Protein and fat are other nutrients as well that slow down the digestion of food. I'm stressing on slowing down the digestion of food because slower digestion of food means that the food will raise our blood sugar slowly. So we will not have the blood sugar spiking. So we really want a slow, gradual release of sugar into the blood. And that is the key to a diet with diabetes. That is the key goal that we are aiming for. Heart healthy, I included heart healthy fat because the diet ideally for diabetes should protect against heart disease because heart disease, high blood pressure and diabetes go hand in hand. And well, a sobering statistic is that most persons with diabetes, they suffer a lot with heart disease. And heart disease is actually the main cause of deaths within persons with type 2 diabetes. So when we're talking about a diet for diabetes, it ideally should be protective against heart disease. And there are different types of fats. So there are fats that increase our risk for heart disease, and there are fats that protect against heart disease. So putting all those things in together, I'm going to show you how to create balanced meals that raise blood sugar levels slowly. So we're going to focus on the nutrients. So nutrition is actually the science of nutrients. So that is what we're going to focus on with this plate. So this plate shows us how to basically portion out the different foods. So a quarter of the plate here is talking about the carbohydrate foods. So this would be things like, the rice, bread, roti, ground provisions, corn, pasta, macaroni, etc. So a quarter of the plate would ideally be your high fiber carbohydrate foods. High fiber meaning, so let's say if we're doing rice, it will be either the brown rice or parboiled rice because the white rice doesn't have a lot of fiber. Similarly, if we're talking any flour products, it will be whole wheat or multigrain as opposed to just plain white bread or plain white roti. Then a quarter of the plate would be a source of protein. So this would be your meats, your fish, poultry, eggs, dairy products as well, so milk, cheese, yogurt. Peas and beans actually are a really good source of protein as well, and for the vegetarians, their main source of protein would be soya or tofu. So that is on a quarter of the plate. Then half the plate is vegetables. So the diet also should be and will be very high in vegetables. Now the vegetables can be cooked or raw. Ideally, you should aim for a mixture of both, but it doesn't have to be either one or the other. It can be a mixture, but it has to be on half the plates. And this quote that I have here on the side is actually from the CDC, so the Centers for Disease Control and Prevention. And they outline why eating like this is important. And it's because eating foods that have the carbohydrates with foods that have the protein, fat, and fiber slows down how quickly your blood sugar rises. So all in all, there's no need to basically cut out anything or do anything drastic. What you have to pay attention to is the combination of the foods that is on the plates and, of course, the portion size. Right, so with this plate, so you're balancing the carbohydrate foods. So in this, let's use the picture. So that's the rice. You're eating it along with foods that have protein. So in the picture, that is stewed chicken. And the fat would be, can come in, let's say if you fry the rice a little bit, or if you wanted to do this sauteed vegetable, that is where the fat would come in from the oil, and the fiber actually comes in from the carbohydrate food. So let's say it was brown rice or parboiled rice, and the fiber would also come in from the vegetables. So you're basically combining the different foods with the different nutrients on your plate while eating. And this is how you basically get stable blood sugar levels when you eat. So eating a meal like this will not spike the blood sugar as quickly as if the meal were to be unbalanced. I'll just go back a bit here because I forgot to mention that part of the diabetes diet can have sweets in small amounts. But that, of course, varies from person to person. Right, and that will be dependent on tailored guidance. So you always speak to a doctor and a dietitian to see what can fit into your plan, because that part is definitely individualized. So now I'm going to show you all some examples of balanced meals that raise blood sugar levels slowly. So these are balanced meals that will not spike blood sugars after eating. And really what is important with nutrition for diabetes is you basically want to maintain a stable blood sugar level during the day. So at no point you want to have the blood sugar dropping too low or going too high. So an example could be steamed or boiled rice with curry chicken or stewed lentils, and let's say sauteed pak choy. So the steamed rice is the carbohydrate food. Ideally, of course, it should be the parboiled or the brown rice. The curry chicken is the protein food, so that's the food that contributes protein to this meal. From the lentils, we will actually get both protein and some carbohydrate as well, and we'll also get some fiber. And the pak choy is the vegetable that provides additional fiber to this meal. So you have carbohydrates, you have protein, and you have a vegetable to provide the fiber. Our next one could be whole wheat sada roti. So this is a vegetarian option with curried soya chunks, tomato choka, and cabbage and lettuce salad. So here the carbohydrate food is the whole wheat sada roti. Of course, that would have more fiber than a white sada roti. Curried soya chunks is the protein food, and you have two sources of the vegetable here for fiber, and that would be tomato choka, which is a cooked vegetable, and you could also have a fresh salad, which is the cabbage and lettuce salad here. Now moving on to some healthy eating tips generally for persons with diabetes. So, as I mentioned, you want to eat more high-fiber carbohydrate foods. So, for example, that would be the whole wheat bread, rolled oats, so not the instant oats, ground provisions, parboiled or brown rice, etc., instead of the usual white or refined carbohydrate foods, because those have less fiber. That would be like the instant oats or the white rice. The second tip would be to eat frequently throughout the day, so every 3 to 4 hours. We want to avoid skipping meals or going long periods without eating, because eating regularly, as I mentioned before, is important to keep the blood sugar stable throughout the day. The third tip would be to drink enough water to stay hydrated. So water has a lot of functions in our body, and it's especially important for persons with diabetes because staying hydrated helps to transport whatever nutrients as well as the insulin around the body, and the water helps us to flush out toxins. Drinking enough water is also the main dietary factor that is needed to prevent kidney stones. So kidney stones are pretty common, and persons with diabetes are actually more likely to develop kidney stones. And the main risk factor for developing kidney stones is actually not drinking enough water or not passing urine a lot. So drinking enough water and staying hydrated also helps from that angle as well. And the last dietary strategy for eating tip for persons with diabetes is to have a regular and consistent eating pattern. So usually that consists of the 3 balanced meals that we would have talked about before using the healthy eating plate, and 2 to 3 snacks in between. Of course, we want to limit using sugar in the diet as much as we can, right? Of course, like I said, how much sugar is allowed in the diet will be dependent on how well controlled your blood sugar is, and it will be individualized. So sweets can be allowed in occasionally, but that is depending on advice from a dietitian, right? So tailored advice. So that is the end of my presentation. So if you all have any questions, I would take that now.
You all comfortable what she said? Yeah. Oh, we have one on up here.
Yes.
Hi, good afternoon.
Hi, good afternoon.
Appreciate the presentation. Question regarding being a vegetarian and being diabetic in terms of those options, and also what are your thoughts on like couscous and quinoa?
What are my thoughts on?
Couscous and quinoa in your diet.
All right. So your first question about being vegetarian. Oh, sorry.
Vegetarian and diabetic, yes.
Right. Okay, so to address that, now the diet for vegetarians usually tends to be higher in carbohydrate than the diet for someone eating meat, and that is because most of the protein sources for persons who are vegetarians do contain some sort of carbohydrate, because usually it's made from soybean. So, and soybean is, well, of course, a legume, and the legumes, the peas and beans, do have some carbohydrate. Now, it's still important, as often as possible, to balance the meals, as I would have said before. So, the main protein sources for you all would be the soy or tofu or peas and beans. So it's really important that those three, either of those three, be at each of the meals as often as possible, because that is the main source of the protein. Nuts and peanut butter also can contribute some protein, so those are also good options to include in the diet as well. Of course, peanut butter that has no sugar added to it, of course, would be the best option. And well, I'll just clarify, so here there are different types of vegetarians, so depending on, let's say, if you do drink milk, you would get protein as well from milk, cheese, and yogurt. So those are also options to include, but they would just have to be lower fat options, because the diet does still have to consider heart health as well.
Massage, what about the quinoa?
Yes, now those also can fit into the diet. Of course, the main thing, as I said before, if you want to try new foods, those are good options as well. Of course, we still want to balance it with the protein and a protein source and vegetables as well. But those are good options.
Any other question? What about coconut water? Is this recommended for diabetes?
Well, it is allowed in the diet, yes. So now coconut water does have some natural sugars in them. So if it is you're having it, you want to at least have it during the day when you're more active, so that you use up the added energy from it. But it definitely is allowed, and it can be a part of the diet, even for somebody with diabetes, yes.
Next question.
Hi, thank you. I'm asking this question because it's a real life experience that I'm having right now, in that I'm getting up early in the morning and go on my treadmill. And while my black fasting sugar, let's say is 110, that I'm using a glucose machine as well. So when I prick my finger, I'm getting 110 on the blood. And with this one here, I'm getting, let's say, 103. But I went on the treadmill and I did, let's say, 45 minutes of exercise. And you know what? I'm hearing my app buzzing off that I'm having a high blood sugar. Now, with the app itself, I'm able to see that I'm having a spike each time without eating. What is the cause of that? Because remember, this is my fasting sugar. So it was very good on the fasting sugar in the morning. Just right after 45 minutes, it became elevated. Let's say for 220 or something like that, but without any eating.
Okay, so just to clarify, so your fasting starts at the 100 and something, and then you mentioned something about exercise. So is that you exercise and then you test back the sugar? Okay, so after the 45 minutes of exercise, that's when you see that the sugar went up, correct? Okay, so...
Let's say 3 weeks, because I'm tracking using different forms of best practices that is concerned. So that is the best practice right now. I'm trying to realize as why am I getting that elevation?
Okay, so question again. So how long after the exercise would you have got the... Oh, it's 45 minutes after the exercise.
No, 45 minutes of exercise. 45 minutes of exercise.
Right, and...
I haven't eaten anything, just drinking the water.
So, okay, so as soon as you finish the exercise, you would have tested the sugar again?
Yes.
Okay. Well, it could be because the exercise, let's say if your blood doesn't have enough of the glucose, your muscles can actually start using additional sugar. So that could be why in the short term, you see that increase in exercise. But over the long term, regular and consistent exercise does actually help the body to use the insulin better. So exercise helps with insulin sensitivity. So it helps the body become more sensitive to insulin or use the insulin better. So while in the short term, you may think that, the sugar is spiking because of the exercise. In the long term, really, it will help to lower the A1C and lower overall blood sugars.
Thank you very much.
You're welcome.
Any other questions?
Hi. So we have somebody in our children with diabetes group that has tried all these different sugars. So she uses coconut sugar. She uses what else? Not stevia. She uses different kinds of sugar, not the sugar replacements like stevia and all of these. But I know coconut sugar is one.
Right.
So I wanted to know, and she finds that her son has better, the blood sugars are better after using things cooked with that. Agave as well. So I just want to know, are these sugars better? Do they raise your blood sugars slower?
Okay, so that's a good question. Thank you for that. So because the coconut sugar and as well agave, they are still a form of sugar, meaning they still would raise the blood sugar to an extent. However, in the context of the overall diet, persons who do use it may find that it actually helps with their blood sugar control. So it really depends on how the sweetener fits into the overall diet. Because the overall diet is really what we want to look at. As opposed to zoning in on specific things, we really want to look at the overall diet. So it could be that they do find that it's more helpful than using the regular sugar. But that really, again, would be individualized. It really would be trial and error.
So that's it. Any other questions? You all comfortable? Hope you all learned a lot of nutrition.
And well, just as a reminder, don't forget that the Diabetes Association actually offers free nutrition consultations on Wednesdays and Fridays. So if you do need tailored guidance, because these were just general guidelines, if you do need tailored guidance, you can always book an appointment with us. All right, that's it for me.
Just no massage. All right, so we just want to present a little token to Miss Massage. I'm just calling Chandra to come and do this presentation, please. All right, so let's give Massage a round of applause, please. Good, so our next announcement, again, for those who did not collect lunches, before you all leave, you all could collect it downstairs in the back where the food was being distributed, right? So now we have come to the end of our lovely program. You know, when you come to the end and time to say goodbye, it It's normally a sad thing because we had such a good time. Did you all have a good time? So then you all should give yourself a round of applause, right? Good. So hopefully, well, I know definitely next year we're going to have more people attending. You all will just pass the word on to the rest of the members who would have missed, as well as friends and families and all those people who you know who is affected by diabetes, right? So I hope you all go home with the little nuggets of knowledge that you all would not have known before, that what you would have gotten today from all the different specialized persons. So on behalf of the Diabetes Association of Trinidad and Tobago, I just want to say thank you all very much for attending and making the symposium a great success. So reach home safely, everyone. Thank you.
Right now there's vibes here on overload, and I can't wait to touch the road. This party here puts you in the mood, the kind of mood to wine with attitude, jumping with hysteria, hysteria. I come here to get on by, yeah. Come let me wind up all day. Hold me, fetting away. Hysterians in the party, and everybody here will Irie. Romanos are them tipsy, and the girls are acting wild and bougie. Come let me wind up, come let me wind up. Come let me wind up all day. Oh, let me fetting, oh, let me fetting, oh, let me fetting away. Come let me, come let me, come let me.